Welcome to another episode of Med Madness. Today we're diving into the fascinating world of thyrotoxicosis and its evaluation through radioactive iodine uptake, or RAIU, findings. This topic is crucial for medical students and professionals alike, as understanding the nuances of RAIU can significantly aid in diagnosing and managing various thyroid conditions. We'll cover everything from defining the condition to exploring its symptoms, diagnostic methods and treatment options, culminating with a real-world case study to bring the topic to life. Next, let's discuss what this condition is. Thyrotoxicosis is characterized by an excess of thyroid hormones in the bloodstream, leading to hyperthyroidism. Common causes include Graves' disease, toxic multinodular goiter, and toxic adenomas. Graves' disease is an autoimmune disorder where autoantibodies stimulate the thyroid gland, increasing metabolic activity and hormone production. Conversely, conditions like painless autoimmune thyroiditis, subacute thyroiditis, and amiodarone-induced thyroiditis lead to decreased RAIU due to the destruction of thyroid tissue, resulting in the release of preformed thyroid hormone. Additionally, factors like excessive intake of levothyroxine struma ovarii, iodine-induced hyperthyroidism, and metastatic thyroid cancer can also contribute to thyrotoxicosis. Next, let's discuss the symptoms and clinical presentation. Patients with thyrotoxicosis typically present with a range of symptoms including fatigue, weight loss, tremors, and heat intolerance. These symptoms stem from the hypermetabolic state induced by elevated levels of T4 and T3 hormones. In Graves' disease, patients often exhibit a painless, symmetrically enlarged thyroid gland. In contrast, subacute thyroiditis may present with a painful, tender goiter following an upper respiratory infection. Moving on to diagnosis. The diagnosis of thyrotoxicosis involves a combination of clinical evaluation, laboratory tests, and imaging techniques. Key laboratory findings include decreased TSH levels and elevated T4 and T3 levels. A radioactive iodine uptake scan is pivotal in differentiating between various causes of thyrotoxicosis. Increased uptake is indicative of conditions like Graves' disease, toxic multinodular goiter, and toxic adenomas. Conversely, decreased uptake is seen in painless thyroiditis, subacute thyroiditis, and other non-thyroidal conditions. Additional diagnostic tools include thyroid peroxidase antibody assays, especially for confirming autoimmune thyroiditis, and thyroid ultrasound to assess gland structure. Next, let's talk about management and treatment. Management of thyrotoxicosis varies depending on the underlying cause. In Graves' disease, treatment options include antithyroid medications, radioactive iodine therapy, and sometimes surgery. Beta blockers are often prescribed to manage symptoms like tremors and palpitations. For painless and subacute thyroiditis, treatment focuses on symptom relief, as these conditions are usually self-limiting. Patients with thyroiditis might benefit from non-steroidal anti-inflammatory drugs or NSAIDs or corticosteroids to reduce inflammation. It's crucial to address any complications promptly, such as cardiac arrhythmias, which can arise from untreated thyrotoxicosis. Lifestyle modifications, including stress management and dietary adjustments, can also support overall thyroid health. Now let's consider a real-world example. Imagine a 30-year-old female who presents 3 months postpartum with fatigue, weight loss, and tremors. Laboratory tests reveal decreased TSH and elevated T4 and T3 levels. A RAIU scan shows low uptake, suggesting painless autoimmune thyroiditis. Confirmatory thyroid peroxidase antibody assays are positive. The patient is managed with beta blockers for symptom relief and monitored regularly. Over the next 6 months, her thyroid function gradually returns to normal without the need for further intervention. Finally, to wrap up, understanding RAIU findings is essential for diagnosing and managing thyrotoxicosis effectively. Early diagnosis and appropriate management can prevent complications and improve patient outcomes. Remember to engage with our pre- and post-podcast quizzes and Anki flashcards to reinforce your learning and ensure a comprehensive understanding of this topic. Thank you for tuning in to Med Madness, and we look forward to exploring more medical topics with you in our next episode.